Welcome to today's episode of Rural Health Pulse. I'm your host, Dr. Jim Kinnear. Today's episode will showcase additional presentations from the Pennsylvania Mountains Rural Health Conference held November 16, 2023 at IUP. At this conference, over 200 participants gathered to learn and exchange ideas about rural health care. Our topics today come from more healthcare professionals who gave presentations at this conference, with discussions pertaining to rural healthcare issues and advice and options for those who are planning to be healthcare practitioners in a rural health setting. Our first guest today is Mr. Jack Sisk, president of Punxsutawney Area Hospital and a state board member of the Pennsylvania Rural Health Model. In his presentation, Mr. Sisk discussed how to change the dynamic of how people think of healthcare, the PA Rural Health Model itself, and the future healthcare models set to be put in place soon. So just to start, welcome to thanks for being here today.
Jim, thanks for having me.
So Jack, could you just start by maybe introducing yourself and what your role is at Punxsutawney Area Hospital?
All right. Hi, my name is Jack Sisk. I currently am the president at Punxsutawney Hospital, a little over a year, but before that I spent 30 years as the chief financial officer and before that the accountant. My only place I've ever worked has been Punxsutawney Hospital.
So today at the conference, you were talking about the PA Rural Health Model, and I was just wondering if you could give a 1 to 2 sentence description of the PA Rural Health Model.
Yeah, what I like about the PA Rural Health Model is it's focusing on keeping people healthy and out of the hospital, but then not putting the hospital out of business because we basically need a certain level under the current model, under the existing model of how hospitals get paid. You need a certain level of sickness and sick customers to stay in business. And this is changing that dynamic.
Why is having this model important, particularly to rural hospitals?
Rural hospitals are generally small, struggling. We're, at least in Western Pennsylvania, all in declining population markets. And when you have less customers because your population is dropping, it's harder to drive revenue. And this program takes us away from trying to drive revenue. It's trying to drive health improvement in our communities and keep people healthy and out of the hospital by preventative services, among a lot of other things.
So hearing that, I hear maybe 2 advantages of the model. One is access, because if rural hospitals aren't able to sustain themselves, they would go away and there would be access to care issues. In addition to supporting that access, the model is also improving the quality of the care that's given as well.
Yes, what we're doing in the rural health model is, we learn from the other hospitals that are in the model is we all try to undertake transformation plans to improve the community health. And while in Punxsutawney we're doing these 3 things this year, I can see what the other hospitals are doing across the state who are in the program. And hey, that's a great idea. That could be one of our projects for next year. We've kind of picked up on the RNOT program here at Indiana that you folks are doing with Armstrong and Clarion for substance abuse issues in the emergency department. We're trying to replicate that in a smaller fashion now up in Punxsutawney, learning from successes from your partners.
And for individuals not familiar with that term, transformation plan, can you give a sense of what that means?
It's basically changing the dynamic of how we think of things. We're trying to transform healthcare to keeping people healthy and not living in that environment where we need to drive volume and revenue into our buildings to be successful. You kind of, in the old model, you shoot yourself in the foot if your community's healthy and you don't have customers. You don't then have revenue, and then you can't run programs, and it's just a negative spiral.
This morning in your presentation, you shared some statistics that showed how hospitals that have participated in this model have improved and changed compared to hospitals that have not, and hospitals overall. What was one of those things that really jumps off the page to you as really a meaningful and exciting thing about the impact of this initiative?
We are seeing reductions in what the industry would call potentially avoidable utilization, where customers may not necessarily need the hospital services because you can conceivably keep them healthier and out of the hospital. We've seen a marked reduction in emergency room activity as well as inpatient activity within the realm of what the insurers would call potentially avoidable utilization, doing things to keep people healthier so they're not needing to access those expensive services.
As you look down the road, what's the future outlook for the PA Rural Health Model?
The rural health model is set to expire. It was a 6-year demonstration project from Medicare. It runs through the end of calendar year 24. The feds, Medicare, runs multiple demonstration projects, and they learn from each of these things. And they normally have a start and an end date, but they take that data and come up with new creative models. Currently, there is a program called the AHEC model. I can't remember the acronym still. Couldn't remember this morning. That is allegedly the next potential opportunity for the rural hospitals in Pennsylvania to enter into, but that wouldn't start until 2026. But we're also learning that in Harrisburg, the powers that be aren't necessarily looking to step the state in because the state has to choose to go into this federal program. So we may not be going in or having an opportunity to go in until 2027. That doesn't mean that we're not going to try to still continue to run with this current model in a slightly different format for those years in between.
So it'll be interesting to see what the next step is for healthcare
Yes.
delivery and transformation.
Yes, but the exciting thing is, we've been doing a lot of these transformation plan projects, and once we complete one, it isn't done. It continues to derive benefits in our community, and they just start to snowball because the following year we'll create new ones. And we're a couple of years into this, and it's starting to snowball and become impactful in our communities, which is pretty exciting.
Speaking of exciting, Punxsutawney Area Hospital has been recognized with several designations for the quality of care and service that you provide. Would you like to share a few of those accolades?
Sure. This is the 5th year in a row that Punxsutawney Hospital was designated as a top 100 hospital of the the rural and community hospitals. There's about 900 hospitals in the country that qualify within this group, and this is the 5th year in a row that we've achieved that designation. And in 2022, we were further awarded a higher honor within that group of being one of the top 20 hospitals in the country within that 900. We're also surveyed on the industry HCAHPS. It's a survey that all of our inpatients get. As we look at how our results are in Punxsutawney, we seem to come out consistently better than many other hospitals in Western Pennsylvania. We're very proud of that effort. We spend a lot of time as an organization with our workforce trying to make sure that we're doing a good job and being impactful for the patients on those items that are important to the patients while they're patients in our facility, like understanding what meds you're getting and why you're getting them, and having communications with your nurses, and that you understand what the physician and the nurses are telling you. So we do pretty well in that area, and we've done pretty well there for many years, and we're excited.
What do you think is the secret sauce or the magic of some of your success in these areas?
I think in Punxsutawney, it's a small community. A lot of the folks that work there live there. Their family members are there. We're committed to the organization. I was born and raised in Punxsutawney, and I've been working there my whole life, and I'm not unique. There's a lot of us up there, so we care about our patients. Not that other folks don't, but I think it's that small knit community that makes it a little more of a tighter family network. And we're fortunate to have that. And Ben, who was to be here today but couldn't make it for this conversation, he has taken the lead in our facility and has for a long time trying to drive these metrics and improve these experiences for our patients. And it seems to be working well. He's done a great job.
That's great. And hearing that local connection and people that are embedded in the community and have that sense of ownership really echoes with a lot of the things we're talking about with rural healthcare
Right.
and growing our own talent
Right.
in our communities.
Yeah, I was excited about what I've heard this morning about what our opportunities are.
Well, Jack, I want to thank you for taking a few minutes and catching up with us and sharing some insights from your presentation.
Sure, Jim. Happy to do it. Thank you.
And then, Jack, anything you want to say about the overall conference and the importance of getting individuals together for something like this?
I think it just magnifies the issues that we're dealing with and the solutions that we're putting in place that will solve this crisis for us. We will develop more homegrown medical professionals that will be able to support us in our rural communities where we see it's difficult to recruit.
Thank you very much.
Sure. Thanks, Jim.
Our next guest is Dr. Dennis Gingrich. He is the former faculty member of the Department of Community and Family Medicine at Penn State Hershey Medical Center and a board chair for the South Central region of AHEC. During his presentation, he discussed the AHEC functions and how it impacts the rural health environment. Well, Dennis, to start, would you mind just introducing yourself and share a little bit about what your professional role is?
Certainly. I'm Dennis Gingrich. I'm a retired family physician who previously was on faculty in the Department of Family and Community Medicine at the Penn State Hershey Medical Center. When I was at Penn State, I served as the Penn State Hershey liaison to the state AHEC program. And now that I'm retired, my primary role is as board chair for the South Central region, one of 7 regions of the Pennsylvania AHEC organization.
Thanks for sharing that. Could you explain what AHEC is?
Certainly. An AHEC, which stands for Area Health Education Center, is a federally funded organization that is or has been available to all of the states across the country. Pennsylvania started about 30 years ago, and it started with a federal grant, an AHEC grant, and since that time has been supported by funds, both federal and state, is currently supported by funds that are from the HRSA portion of federal grants and grants that come from the Department of Health of Pennsylvania. The role of an AHEC really is to help provide support and facilitation and coordination for serving rural and underserved areas of a state with regard to medical care. And that can be everything from facilitating students who are in high school, college, or med school to consider rural and underserved careers in those locations. It can be assisting public health and community health organizations in patient or community education. It can be visiting schools, high schools, middle schools, or elementary schools to help promote careers in the health professions. And it can be any of a variety of ways. The way Pennsylvania's AHEC has developed was highly organized to help the pipeline of future physicians into underserved and rural areas, and to some extent primary care as well, since that's certainly a rural and underserved need. And it's been a coordination between several medical schools in Pennsylvania, healthcare systems, community health agencies, and private practices, all put together trying to move in the same direction.
Thanks for sharing that background. So in Pennsylvania, are there unique challenges that the AHEC has to address?
Believe it or not, there are, people outside of Pennsylvania think of Pennsylvania as being an urban area. A lot of my friends think of that as Philadelphia and Pittsburgh, but there are a huge number of rural locations and citizens who live in rural locations in Pennsylvania. And rural locations provide unique challenges to healthcare delivery. For example, if there are not sufficient services or sufficient physicians or other healthcare providers in the community, then citizens are forced to go elsewhere to travel for services. And that is not only inconvenient and expensive, but it actually increases risk. If you can imagine, like, for example, someone who's pregnant who runs into complications, but there is no pregnancy or OB services in the local hospital, or no OB in the local community, or no family physician who does OB in the local community. Even if in an emergency, they might need to travel farther away for those services, and that increases the risk for mother and baby. That's just one example.
Yeah, that's a great example of how healthcare disparities and workforce shortages have a great impact on a very personal level.
And one of the goals of the Pennsylvania AHEC, as is the case with other AHECs, is to not only improve the quality of care in rural and underserved areas, but improve equity as well.
Now, you mentioned physicians earlier. Does the AHEC work with other health professions and occupations as well?
Yes, it certainly does, yeah. It works with many of the other health professions, certainly nursing, physical therapy, occupational therapy, and many others. It's not just in medical schools that it works with. It works with other health professions as well.
So as we think about, we're situated here in Indiana County, Pennsylvania, are there things that maybe we're not tapping into, or things that we should be exploring or asking of the AHEC of what options or solutions or ideas that you might help us to address workforce shortages?
Yeah, since I'm not a resident of Indiana County, I'm not quite sure what the local needs are, but many rural communities are benefited by more public health education as to preventive health services, for example, personal health practices that can lead to better health, and even how to access and navigate the healthcare system. All of those are things that many rural communities benefit with their residents knowing more about. And I would suspect that maybe Indiana would be one of those communities as well. You are fortunate in having a large medical center here that provides a lot of services. Many many rural communities are not quite that fortunate.
Well, that's a great thing to hear about Indiana County, that we do have some services and we have some things that we can be very proud of in terms of what's available here locally. As you think about a conference like you're attending here today, what do you think is the importance of bringing rural healthcare leaders and providers together for these types of events?
Well, believe it or not, not everybody knows what everybody else is doing. And not everybody can keep up with what are the brand new things that are available that might be repurposed in some way or have unique benefits for the delivery of healthcare in rural and underserved areas. So this is an opportunity to catch up with what's going on, to better understand new developments, and to simply share across disciplines and across geographic areas what's going on, because this is a great idea sort of incubator. And just with the conversations are great, as are the lectures and discussions. So it's just many ways to interact with new ideas, new people, so that we're all kind of up to speed on the same page.
Great. Well, that's great to hear. And I just want to thank you so much for your time and coming and telling us a little bit about AHECs and what they do, and help us understand how that's part of the puzzle in terms of solving some of the workforce challenges that we have in healthcare.
It's been my pleasure. Thank you very much. If I could, perhaps I could just say that there is a Pennsylvania AHEC website that is available at PAAHEC. That would be PAAHEC.org. That would be available to any listeners to easily find more information on it.
Great. Thank you so much for sharing that. We'll be sure to check that out.
Thank you so much.
Our final guest for this episode is Dr. Richard Whalen. Dr. Whalen is a family physician from Titusville, Pennsylvania. He spoke on the topics of lessons learned and advice, reflections from one rural Pennsylvania physician. Maybe just to start is, Dr. Whalen, would you introduce yourself and share a little bit where you currently work?
Sure. My name's Richard Whalen. I work in Titusville, Pennsylvania, which is a small community of about 5,000 people in Crawford County. It's in the most eastern part of Crawford County, almost in Venango County. And I'm an internal medicine doctor there.
How long have you worked as a physician there?
28 years.
So in your presentation today, you shared lessons learned and advice and some reflections of your experience as a rural healthcare physician. A couple things jumped to mind. As one, you talked a little bit about how technology has changed. And for folks that might not have had a chance to be part of your presentation, any example and in terms of changes you've seen there?
Well, yeah, the most dramatic thing I think that changed is the initiation of the electronic medical record. We had the paper and piles of paper charts for many years, and the electronic medical record has just revolutionized the way we pursue, the way we treat patients and pursue them to get follow-up testing done, screening testing done, those kind of things. It's one of the lines I didn't say in my speech was there was this gigantic pile of charts, and I was going to, invite someone from the audience to wade through there and find Mrs. McGillicuddy's colonoscopy report, because that's kind of what we were dealing with in that era. And so slowly but surely we transformed the paper charts into the medical record that we have now, and we're able to use it proactively to treat patients and prevent disease rather than just react to disease.
And you had some great visual illustrations of the before and after in terms of how things have changed. So very exciting to see.
Yeah, it was
that.
pretty remarkable. I went and I have a two-floor office, and the second floor is where all the charts are. And I hadn't been up there in years. And actually, there was another half dozen pictures of that I did not include. There's a ton of charts up there, so it's pretty nuts,
What would you say is the most rewarding aspect of being a physician in a rural community?
I think it's interesting, and I was obviously in preparing for my speech thinking about how many patients I have conversations with that I know are interested in, let's say, hunting, which I have zero interest in, or auto mechanics. They're rebuilding a car. They are involved in these activities, which I don't really know much about, and I don't really have any personal interest in, but I know they're interested in them, and I can talk to them about that, and it's almost ongoing conversations about, how's that car coming along? Oh, I did the priming and did the painting and those kind of things, which again, to me, doesn't sound very interesting, but the patient immediately relaxes and likes to talk about those things, and it changes the whole dynamics of our conversation instead of me just berating them about their health.
How do you think that connection helps ultimately healthcare outcomes?
Well, hopefully it helps them enough that they're not unwilling to come in the first place, which is an important part of the plan. And then they've kind of figured out, oh, he's kind of just a regular guy. And, if he wants me to do this, it's probably a good idea, as opposed to somebody who's, looking in a book and saying, we have to do this, And I try as much as possible to limit any intervention for my patients that I know is not going to help them, which sounds simplistic, but it's really not as simple as it sounds, because there are so many things we do in medicine that are of marginal benefit. So I really try to focus on the things we know are going to be helpful for them to help keep them healthier or make them healthier.
That's fascinating, and I think that connection and being able to relate to people is so important. What would you say is the biggest challenge of being a physician in a rural community?
Usually it's the volume of issues that a patient comes to the table with, especially older, complicated, sick patients. And then translating what I'd like to do for them into actually getting done. So I've had people not have procedures done because they can't get a ride. They live 25 miles from the hospital and they can't get a ride to the procedure. Or they don't have any family members to take care of them after a procedure they need. So all those sort of issues, logistics, make care that much more complicated in a rural area versus a city where at least you could take a bus or potentially, an Uber. We don't have anything like that in Titusville. So that gets to be really hard for an older person to safely navigate those things.
Thank you for sharing that transportation, access to healthcare. That's definitely a theme that we hear about a lot with rural healthcare. For sure. If you were talking to somebody who was a pre-med student and they were thinking about wanting to be a physician and pursuing that, and they were thinking about being a rural healthcare physician, what advice would you give them?
I think, as I said in my speech, and I'm not just saying it, it's hard for me to imagine a better profession than being involved in medicine some way and somehow. It's such a gratifying career, and you'll never regret doing it. The problem is the getting from that undergraduate or pre-medical area to actual practicing as a doctor is a lot of years and a lot of heartache and classes that are deemed very important by medical schools that actually are not useful as a doctor, such as organic chemistry or these classes that you really are physics or calculus, things I had to take a couple of years of for my undergraduate, which really I've never used since then. Little snippets here and there, but considering how important they are in the process of applying for med school, how difficult that is. That's such a difficult thing for a lot of people to traverse, and I would encourage people to just get through those things because it's not like medicine is like chemistry. It's not like medicine is like organic chemistry or physics. It's much more. I was an undergraduate major in psychology, and psychology is much more valuable than any of the hard sciences for practicing medicine, I think.
That's a really interesting insight. Thank you for sharing that. What do you think is the value of conferences like this to bring people together and have people talking about pathways and pipelines and some of those challenges?
Well, I do think that there's so many things out there that you just don't know about. And I personally know several young people that are thinking about going to medicine from my hometown that I now can go back to and say, there are things available. And I might not remember exactly what they are, but I now have people I can contact to reach out to and get that information for people. So it's been very valuable that way. I think we all recognize there's a problem with a lack of physicians in rural areas. And 28 years ago, I came to Titusville, and we were the young guys in Titusville. And unfortunately, 28 years later, we're kind of still the young guys, and that's not good because it's just a matter of time before one of us starts to retire. And when you have a group of 4 doctors, once one person retires, then the other people who are looking to slow down or actually become busier, and one by one, will drop off potentially if we don't have replacements in place. So that was a long answer to that, but I do think this is the kind of place where you can imagine getting a start, finding more help, and also being there for some of the future students that I know personally and professionally.
Well, Dr. Whalen, I want to thank you for, first, your presentation here at the conference, which I thought was very interesting and very insightful, and also taking some extra time here to share some more insights for folks that didn't get a chance to hear that presentation. Thank you.
Oh, it was my pleasure. You're welcome.
And that concludes today's episode of Rural Health Pulse. And our next episode will be featuring some final highlights and presenters from the 2023 Pennsylvania Mountains Rural Health Conference at IUP. The Pennsylvania Mountains Rural Health Conference is a forum for rural health leaders and providers. The 2024 conference will be held on Thursday, November 21st at Indiana University of Pennsylvania. Please visit the conference website at pmrhc.org for more information on future conferences. I am Dr. Jim Kinnear, and thanks for listening to today's Rural Health Pulse.